Hi, hello everyone. Welcome to discussion of MCCD. Okay, MCCD. The topic of the week is MCCD. What is MCCD? What is MCCD? The MCCD means medical certificate of cause of death. Okay, like example, myocardial infarction is a cause of death. So we are talking about MCCD today. Basically, the practical aspects of MCCD, how to write MCCD in your exam. It is one of the major exercise asked in your FMT practicals. So, according to recent CBME guidelines, MCCD, so what are the components of death certificate? Or what we can say, what is the checklist? Usually, it is asked for 5 marks question or sometime 10-mark question also. 10-mark exercise in various universities. So, what are the components? How to write death certificate? What you must write in death certificate? Okay, death certificate. You need to write the properly name of the hospital, like LNGP Hospital, New Delhi. Name of the hospital, date and time of death. So, what is the time of death as well as date of death? That you need to write. Then name, age, sex of the person who died, that carry half mark. General particular, that carry half mark. Cause of death. Very important is cause of death. Like what is 1A, what is 1B, what is 1C, what is 2. So how to write accurately the sequence of death, that carry around 2.5 mark. Manner of death. Manner of death. What do you mean by manner? So manner means, as we discussed many times in our classes, it can be suicide, homicide, or it can be accidental. So that word should be there in your death. Manner of death. Whether it is associated with pregnancy or not. That line should be there, that carry half mark. Finally, the signature of the doctor, like Dr. Manjunath, MBBS MD, Maulana Azad Medical College, New Delhi. Name and designation. So this is the standard components of the certificate according to CBME curriculum. Let's see now one by one some important concepts and also some 10 examples and some frequently asked questions. What are commonly asked questions in your Viva? And what are the common mistakes you tend to do while writing the certificate? All this we're talking about. So, this is the Form 4. Remember, Form 4. The Form 4 of MCCD are inpatient death. Okay. Form 4A, that is for non-institutional death. Again, I'll repeat. There are two forms. The form number 4, that is for institutional death. Like example, medical college, the hospital. Non-institutional death, like example, a clinic. That can be Form 4A. This can be asked in our exam. What is Form 4? What is Form 4A? Rest are almost same only. So what you can see here, name of the hospital. First thing, you need to fill all the details properly. Whatever that is given in your exercise. Like MAMC New Delhi or LNGP Hospital New Delhi. Okay. I hereby certify that the person died in hospital, ward number, the date and time, that you need to mention properly. That is very important. The name of the deceased, whether male or female, then the age. If age is more than 1 year, then you can write in years, like 45 years, 50 years, like that. If age less than 1 year, that means it is infanticide, then you can mention in months, 6 months of age, 7 months of age, like that it is. Okay. If age less than 1 month, then you can write the age in terms of days. How many days it is, like that. All of you, am I getting my point? Getting my point? Any doubt you can ask me in between. Any doubt you can ask me in between? No issue. Okay. If less than 1 day, then you can mention in hours. All these are preliminary details. Then finally comes is the cause of death. Very important, okay? This is the very important aspect of your MCCD that we are going to discuss in detail in upcoming slides. Then manner of death, natural, accident, suicide, homicide, or pending investigation. How did the injury occur? This line, whether it is associated with pregnancy or not. If yes, you can write yes, otherwise you can write no. So this is the form 4. Form 4 is also almost same only. So now we are talking about very important, that is the cause of death. So this is the one very frequently asked in your NEET PG exam, FMG exam, as well as your prof exam. Cause of death. So cause of death has two parts. How many parts? Two parts. What are the two parts? Part 1 and part 2. Remember this. Part 1 and part 2. Part 1, that consists of again 1A, 1B, 1C, 1D, like that. Okay, 1 again, 1A, 1B, and 1C. So, or sometimes 1D also. Usually it is up to C it is. Okay. What is part 1 or part 1A? You can see here, part 1A is immediate cause of death. Immediate cause of death. Remember, it can be a state of the disease, or it can be injury, or it can be complication which caused the death, not the mode of dying. Most of the students, they mention cause of death is cardiorespiratory failure. This is 100% wrong. Don't mention mode of death as cause of death, because most of the cases, almost 90% of the cases, finally there will be cardiac failure, cardiorespiratory arrest. Okay, so don't write that. Avoid all these lines. Cardiac failure, respiratory failure, asthenia, all this you should avoid. It should be a specific cause of death, that is 1A, immediate cause. What is 1A? That is immediate cause. Immediate cause. Immediate cause can be disease, or it can be injury, or it can be complication. That is 1A. What is 1B and 1C? They are usually antecedent cause. Antecedent. 1B. What is 1B? 1B is a morbid condition, if any, giving rise to above cause. So they are giving rise to immediate cause. They are giving rise to 1A. So 1B giving rise to 1A, 1C giving rise to 1B it is. So 1B give rise to 1A, 1C give rise to 1C. They are usually antecedent cause. What do you mean by antecedent? Come before. The meaning of antecedent is come before. That come before the 1A. Okay. So this is antecedent cause. Antecedent. So this is also antecedent cause. And remember, this is the main cause. Main cause. So main cause give rise to antecedent cause. Antecedent cause give rise to immediate cause. 1C give rise to 1B, 1B give rise to 1A. Okay, I'll give one more example for that. See here, this is a good example. So very nice picture. In this picture, what we can see here, grandmother, mother, and granddaughter, right? So I can consider grandmother as 1C, 1C, 1C give rise to, that is 1B, 1B give rise to 1A. So it's all based on the pathogenesis or the time of onset. 1C give rise to 1B, 1B give rise to 1A. Grandmother, mother, and granddaughter. You can remember like that. You will not forget it. So come back to this now. Now, what is 2? The 2 means contributory cause. Contributory cause. Contributory cause. What are the contributory causes? You know, usually diabetes mellitus, hypertension, smoking, alcoholism, or any surgical causes, iatrogenic causes. So they are actually contributing, but they are not directly related to disease or condition causing death. So you can see here lines given in the standard certificate. Other significant condition like alcoholism, smoking, contributing to death, but not related to disease or condition causing it. So how many parts are there? 2 parts are there. Part 1 again classified into 1A, 1B, 1C. 1C main underlying cause, 1C give rise to antecedent cause, and 1B give rise to 1A immediate cause. 2 means contributory cause. And here one thing you need to write, that is interval you have to write. What is the interval? How many days between 1A and 1B, 1B and 1C? That is very important. Okay. Next. Now one example you can see here. Polycystic kidney disease. As you know, polycystic kidney disease. The polycystic kidney disease, it's an autosomal condition characterized by multiple cysts over the kidney. So polycystic kidney, one of the common complications is hypertension. Because of hypertension, there can be renal failure. So polycystic kidney disease is 1C, hypertension is 1B, renal failure is 1A. So you can see here, this is how you can mention. So it is all based on the pathogenesis or time of onset. Okay. This is you understood. Any doubt you can ask me here? Any doubt? Any doubt? Any doubt? Okay, now we are talking about some important examples. Okay, examples. So, some important examples. Let's see. First example. The first example, death due to IHD. What is IHD? Ischemic heart disease. Ischemic heart disease. Let's see how to write the certificate. One example, okay? Ischemic heart disease. The patient was suffering from chronic ischemic heart disease. Ischemia. Since 8 years. How many years? 8 years. Ischemic heart disease can lead to what? Acute MI. Acute MI can lead to pulmonary embolism. Again, you can see here duration. MI since 7 days. Pulmonary embolism since 1 hour. So this is the correct sequence. Correct sequence. One example. Again, it is based on the case actually. Part 2, what you can see? Diabetes mellitus, obesity, hypertension, congestive heart failure. Anything that is contributing. This is one good example. Common example. So what you can see here, mode of death you should avoid. Mode of death, like example, cardiorespiratory arrest, Okay, shock. So all this you should avoid. You should mention what is the cause of death. Okay, 1A. Remember 1A always you need to write. 1A is one entry, always entry. Say loudly, 1A means one entry. Always you should mention at least one entry. One entry, always entry. Don't mention too many cause of death in one. Mention only one, and also it is always entry. Sometimes what happens in some cases, there won't be one B, there won't be one C. You can write one A only. You can write one A and you can leave rest of the columns. So 1A, always one entry. Don't do too many entries in this. Always entry. Always entry. One entry, always entry. One B antecedent cause. One C main underlying cause, known as essence of death certificate. This is asked in your exam. Essence of death certificate, that is 1C. Okay, one good example. Now we're talking about second example. Death due to peritonitis. Immediate cause of death is peritonitis. Let's see how to write. You need to think about what is the cause for peritonitis. Perforation होगा. Why perforation? Duodenal ulcer. Pathology. So duodenal ulcer giving rise to perforation. Perforation giving rise to peritonitis. Here sequence is very important. Ulcer since how many months? It is since 6 months. Perforation since how many days? 3 days. Peritonitis since 2 days. So this is the correct sequence. Okay. And also patient suffering from carcinoma truncus is contributory cause. One more good example. And in the picture you can see there is a extensive peritonitis, bacterial peritonitis, fecal peritonitis leading to death. Next. One more example related to COVID-19 cases. Okay, COVID-19, how to write. So COVID-19, this must be 1C. Underlying main cause is 1C. See that one well-known complication of that is acute respiratory distress syndrome, ARDS. ARDS, one complication, respiratory syndrome. Respiratory acidosis caused by ARDS, ARDS caused by COVID-19. Again, you can see here time sequence 7 days, 3 days, and 2 days. So the correct sequencing is very important. Okay. So if you write COVID-19 here, so it will it will become a wrong certificate. Wrong certificate. How COVID-19 is caused by ARDS. How ARDS is caused by respiratory acidosis. So this is what you need to write. You need to think logically while writing the certificate. One more example देखते हैं. Death due to hypertrophy of prostate. Now think how hypertrophy of prostate can lead to death. Probably there can be uremia, right? So hypertrophy of prostate, retention of urine, uremia. So one more example. One more example. Road traffic accident. Road traffic accident give rise to what? Fracture of the skull. I know. So fracture of the skull. This is one example. Death due to gunshot injury. So gunshot injury give rise to what? Perforation of heart, cardiac tamponade. Consider gunshot injury to the heart. Here, gunshot injury over the heart. So left side of the heart. So probably there is a perforation of the heart. That you will come to know after doing autopsy. Then cardiac tamponade. Cardiac tamponade is 1A, 1B. Perforation of heart, gunshot injury, that is 1. Again, time sequences you can mention here. It's very less. Okay. One more example. Now let's see one incorrect certificate. Now let's see what is the incorrect certificate and how to write correct certificate. Case of gangrene of foot. So here you can see here patient is having gangrene of foot. He died due to some complication. So the certificate given by some attending physician is like this. What he has written? Diabetes is 1A, gangrene of foot is 1B, carcinoma pancreas, chronic bronchitis in 1C. Part 2 he left blank. Anyone can you tell me what is the correct certificate? What is the correct certificate? Let's see who is going to answer this. One. Okay. So anyone, can you tell me in the group? Can you just message me? What is the correct certificate? Yes, time travel and others. See who is going to answer. What is the correct certificate? Let's say I'm just waiting for you. Waiting for your response. So this is incorrect certificate. You tell me now how to write correct certificate. Correct certificate in this. Okay, correct certificate. Let me explain. So the patient died due to gangrene of foot. What was the cause for gangrene of foot? Diabetes mellitus. And carcinoma pancreas can lead to diabetes, as you know. So this is 1C, 1B, and 1E. Chronic bronchitis, it is not the immediate cause, the contributing condition. So it is comes under part. This is correct certificate. Okay. If you think diabetes leads to gangrene of foot, then you can write 1A and 1B, and you can write C in the part 2. It's all based on the sequence actually. It all left to the physician. Okay. One more incorrect certificate given by one of the physician who died due to, that is, the patient died due to uremia. 1A he mentioned retention of urine with hypertrophy prostate with a uremia. 1B he mentioned cataract. 1C he mentioned ischemic heart disease. See, now what we can see here, this certificate is completely wrong. Look at the pathogenesis, how ischemic heart disease can lead to cataract, how cataract can lead to retention of urine. So this is totally wrong certificate. Totally wrong certificate. The certificate. What is the correct certificate? Let me explain. That is hypertrophy prostate. When hypertrophy prostate is there, that causes retention of urine. है ना? एक complication होगा. So retention of urine can lead to what? Uremia होगा. Uremia can be a cause of death. But here, cataract and ischemic heart disease comes under part 2. Part 2. Yeah. So this is how you need to write properly in your exam. One more incorrect certificate. What we can see here, it is mentioned 1A is HIV, 1B pneumonia, 1C septicemia. So patient died due to septicemia. He mentioned it in 1C. Septicemia leading to pneumonia, how it is. Pneumonia leading to HIV, how it is. How it is completely wrong. So this should be HIV infection hoga. HIV lead to pneumonia hoga. Pneumonia leads to septicemia. This is the correct sequence, correct MCCD. Last one. Now, last certificate, patient died due to renal failure. Renal failure due to polycystic kidney disease, suffering from hypertension. How to write correct certificate? What we can see here, a polycystic is an autosomal condition associated with chromosome number 16, well-known complication. So, incorrect certificate he mentioned as polycystic kidney disease, 1A, renal failure 1B, ischemic heart disease. Now, see, this is completely wrong certificate. How ischemic heart disease can lead to polycystic kidney? I know. How renal failure can lead to polycystic kidney? So, this is completely wrong. The correct should be polycystic kidney disease, hypertension, renal failure. Kidney, that is hypertension, hypertension that leads to renal failure. Ischemic heart disease should come under part 2. So all these are some important example. 10 examples. Now what are frequently asked question? Let's see what are frequently asked question for Viva. First question comes as importance of reporting sequence accurately. What is the example for that? I'm telling you, it's all left to physician. Okay. The example, one example here. A diabetic man. A diabetic man who had been under insulin control. Diabetic man, so insulin control for many years. He developed ischemic heart disease. So he was diabetic. He was also suffering from ischemic heart disease. He died due to MI. Okay, around 45 is the age. So male patient, male patient. Now see here. So MI definitely 1A is MI only, myocardial infarction, no doubt in. And MI is caused by ischemic heart disease. There is no doubt in that. That should be. If diabetes mellitus, if you think diabetes mellitus causing chronic ischemic disease, then you can write in the 1C. If you think chronic ischemic heart disease is independent of diabetes mellitus, then you can write diabetes mellitus in the contributor. You can keep 1C empty or blank. Okay. So always entry, one entry should be 1A. Antecedent cause 1B. Main underlying cause that should be, that is 1C. And how to write the proper sequence, it's all left to you. You need to think logically. For that, you must know the pathogenesis very well. Next comes is the how many cause of death can be entered in part 1? Part 1A. Remember, it should be 1. Always 1. Only one cause. So write one cause in 1A, one cause in 1B, one cause in 1. Don't write too many causes. Hypertension, diabetes, chronic bronchitis, cataract, something. Avoid mode of dying. Only one cause should be. Second thing, what if there is only one condition? There's only one condition. What I must do? You can write in 1A, 1B, and 1C. You can keep blank. You can write 1A, you can write 1B and 1C. Okay. Next. What should be entered in part 2? Already we discussed. In part 2, you must mention other significant conditions. What are they? Like alcoholism, smoking history, environmental factors. So all this you can write in the part 2. This can be asked in your Viva. So already we discussed in the previous slides. What should you avoid while completing MCCD? You should avoid abbreviations. Avoid abbreviations. Some doctor they mention CRF, they write CRF like this. CRF, remember, don't write that. CRF, think it is chronic renal failure. It can be cardiorespiratory arrest also. That's why write properly the complete line. Avoid. Don't write MI. Instead of writing MI, mention it as mitral. So you can mention myocardial infarction. MI can be mitral incompetence also, no? Can be incompetence. AD, some mention AD. AD matlab kya? Acute diarrhea. It can be Alzheimer's dementia also. MS, they mention some MS. MS can be multiple stenosis. It can be multiple sclerosis also. Some they mention RTI. RTI can be respiratory tract infection. It can be reproductive tract infection. So that's why avoid abbreviations. Second thing, avoid mode of dying. Avoid mode of dying. Like example, cardiac arrest, heart attack, cardiorespiratory failure, cardiorespiratory arrest, shock, heart failure, coma, debility. All this you better avoid. Instead of that, you use proper medical words. Instead of writing hypovolemic shock, you can mention hypovolemia. Hypovolemia. So avoid mode of dying as a cause of death. Next, avoid vague terms or ambiguity. Like example, say some doctor they mention irrelevant talking and feverishness. ये क्या होगा irrelevant talking मतलब what is relevant talking? Or some they mention very poor nourishment, very poor, very good nourishment. What it is? Don't mention that. Less healthy at birth. They mention like that. Avoid all these terminologies. Instead of that, if you want to mention cause of death is delirium, you can write delirium due to fever. If you want to mention malnutrition, you can mention severe malnutrition or malnutrition. Instead of telling less healthy, you can write LBW, that is low birth weight or congenital anomaly. Avoid short term, like example, CABR. What is CABR? Carcinoma breast or cancer brain. Acute, in fact, avoid all these short forms. Avoid symptoms and signs. Some they mention symptoms as a cause of death. Like example, jaundice. How jaundice can lead to? They mention fever. Fever can lead to death. How? Instead of that, you can write hepatitis, infection you can write. Now next question is, next Viva question can be asked. Can doctor charge fees for issuing death certificate? Can you take some money, some like 500 rupees, 1000 rupees? Can you charge? Yes or no? Yes or no in the group? Anyone can answer? Can you charge fees for issuing death certificate? Issuing death certificate. Batao, batao. Anyone in the class? Anyone? Yes? Yes or no? Can you charge? Yes or no? Your answer should be no. No fees. No fees is taken, okay, according to Central Birth and Death Registration Act 1960. So, this is how your answer should be. No, sir. No fees is taken as per Registration of Birth and Death Act. Fine. Death and birth should be registered within 21 days. And question number 9. Now, sometime what happens? Broad dead patient or dead on arrival patient. Can doctor issue death certificate in unnatural death or suspicion or broad dead patient or dead on arrival? So, unnatural death, like example suicide. Suspicion, like example case of homicide. We're having suspicion or broad dead patient or dead on arrival. Whether can you can you issue death certificate? So according to me, no, don't issue. Don't issue. You send or inform the nearby police station, ask for the autopsy. So while during autopsy, we'll come to know what is the exact cause. Then question number 9. Issuing false certificate. Is it a punishable offense or not a punishable? It is a punishable offense under various IPC sections. And also issuing false certificate can be punishable under medical ethics. So the NMC can suspend your license of practice for few years or permanently. So one example you can see here, Delhi Medical Council suspend doctor for providing fake medical certificate to man on trial. So it's a punishable offense. One more example, Delhi Medical Council suspend doctor for issuing fake medical certificates. So it's happening everywhere. Then last question, very important question, which is known as essence of death certificate. Essence of death certificate. Essence of death certificate. Let's see who is going to answer this. Hmm? Essence of death certificate. So essence of death certificate, nothing but your 1C. 1C. 1C is known as essence of death certificate. 1A, 1B, and 1C. So finally, the summary. The summary is MCCD means, that is medical certificate of cause of death. It can be Form 4 or Form 4A depending upon institutional death, non-institutional. The checklist we discussed in the beginning, we can go through that. The very important is giving cause of death. That is 1A, 1B, and 1C. Remember, grandmother, mother, and granddaughter. 1C leads to 1B, 1B leads to 1A. So, contributory condition comes under part 2. If there is only one condition, then you can write in 1. If two condition, 1A and 1B, you can write 1C, that is blank. 1C is known as essence of death certificate. The correct sequence you need to understand and you need to write properly. Avoid vague terms, avoid ambiguity, avoid short forms, avoid mode of dying as a cause of death, like example cardiorespiratory arrest, like that. So this completes the MCCD in 25 to 30 minutes. Wish you all the best. In next upcoming class, I'm going to discuss about examination of accuse of right. What are the medical legal aspects and how to write proper certificate in your exam. Thank you.